This is How Did I Get This Far, a podcast tackling the basic skills and knowledge that we all completely missed learning. Soon enough, you'll stop having to ask yourself, how did I get this far? On this episode, wait, so that crack and pop sound I hear is actually gas being released from stiff joints that have been locked up for who knows how long? It's time to find out, how did I crack my back this far? Hi everyone, make sure you're sitting up straight because today we are taking a crack at the basics of pain relief. With us today is Dr. Jordan Estrada, a chiropractor who became a viral sensation on social media, remixing lyrics of popular songs to educate viewers about back, neck, and knee pain. Thanks for being here, Jordan.
Thank you for having me, Amanda. Really appreciate it.
Yes, what made you choose to become a chiropractor and a social one at that?
Okay, we'll start off with chiropractor. I came across a chiropractor when I was dealing with a lower back injury. At that time, my mom was working for one. She said, try out a chiropractor. I had no idea what it was. And to be absolutely frank, I thought a chiropractor was something in real estate, as weird as it sounds. However, she really highly recommended it. I was like, I'll give it a chance because, I was very big into working out, lifting, staying physically healthy. And chiropractor helped me in maybe about a few treatments. I was very shocked. I never even heard of like this side of care before. Most of the treatment I had was on the medication side, and that's all I knew. So that's what made me fall in love with the profession. And I saw myself doing that for the rest of my life because I want to be able to provide that same, answer to people's pain on that end as my own chiropractor and be able to help, lives for myself. I love that feeling of kind of that instant gratification, but offering that sense of alternative care to patients that may not know about it. But fast forward about 4 years, I've been going through a whole social media journey. Instagram was my first, should I say, attempt at it, where I would demonstrate stretches, physical therapy type exercises, all those to kind of give my viewers a sense of or a form of self-care at home. However, fast forward to, let's say, quarantine, I came across TikTok, and TikTok is really where I figured out my true niche in social media, like you said, where I'll remix my songs to put instructions to self-care tips, which it came together perfectly for me. Now I have like all my passions into one little video.
Yeah, and it's fantastic. And I love that it started off with you having no idea what a chiropractor was. So I think that's a perfect inspiration for the people who are listening to this podcast.
Yes.
So it's amazing. What a great journey. All right, well, let's adjust to the next segment of the podcast. Thank you.
Yes.
We're going to do good advice, bad advice. So I'll give you advice that I've heard over time or I found on the internet, and you'll decide as a professional if this is actually good advice or bad advice.
Gotcha.
All right, First one.
Mm-hmm.
It's bad for your joints to cross your legs.
I'd say to cross your legs is not a bad thing depending on how like tight your muscles are. It depends on the person. It's gone around a while. Yes, and for certain people it may be uncomfortable for you, but it's not really doing anything bad to your joints depending on what kind of surface you're sitting on, what kind of muscles are tight in your body. So in simple terms, I would say I wouldn't say it's bad advice, but if it's uncomfortable, then there's something going on with your body where I would still tell you to seek a provider, a nearest chiropractor, physical therapist, or your primary physician, but not more so on the myth side. It's not bad for everybody.
Okay. All right. So I thought it was like a definite, like you're hurting your knees or something. I don't know. So, okay. So it's only if it's actually really painful. Okay.
If it's so I guess if it's uncomfortable, then I would tell you, hey, either switch your position, of course, or find a new chair or new chair support for your back and your hips. There's ways to modify your chair because that position there sometimes can be better for people that have tight hips because it can open up the hips too.
Oh, we're going to go into that more because I feel like I'm developing hip issues. I'm getting old, so.
Okay.
All right.
For you.
The next one, staring down at your phone can cause a lot of back and neck problems.
Yes, I do agree that is true for majority of people because it puts us in a position where we are where we're straining a lot of our spine muscles in our spine, and that over time can cause your muscles in your neck to get tense, your upper back, your middle back, and your lower back too. So it does come along the lines of making sure you do take time out of your day to have a good routine to maintain good posture. And that can come multiple ways.
Okay. So would you say if you are still going to be staring at your phone all the time, you should just like hold it like right up, like at the same level as your face? Or is that just because that looks stupid, but is that a quick fix?
I would tell you it's a temporary fix. You know, not everyone in this world's gonna walk around the street with their phone in their face, because the people are gonna think you're recording the other, so it looks goofy. Yes, it's technically better. However, it's not a long-term thing, because your arm's gonna get tired holding up the phone the whole time.
Okay,
So,
all right, put your phone down, everybody.
So you can keep it down. Just take breaks from your phone whenever you can throughout the day to move around and stretch, because in the long run, most people won't be able to maintain the phone up at their face. I can't even do it, right? I'm doing it right now. I can't even do it.
All right. We'll do the next one then.
Mm-hmm.
When you roll your neck
Mm-hmm.
and you hear the crack when you do the part where you're leaning your head back and you hear that cracking sound, it's actually your neck hitting your spine bone. I'm sure there's a professional term for that. And that's actually bad, right? Is that true?
I'd say to continue, if it happens, because you are hitting bone on bone, so it's kind of like you're grinding bones together.
Okay.
It would. Oh,
I'm grossed out. But go ahead.
Sorry, it's kind of a cringy feeling, but it's not gonna. I mean, to be absolutely honest, it happens accidentally. You know, that's okay. Just don't keep doing that, because it's not going to necessarily make you feel better or change anything. It's like kind of those weird little things that we want to do because it just sounds weird. We want to keep recreating it because it's kind of like it's a bad habit. But yes, don't keep doing it. If it happens accidentally, it happens accidentally, but don't force, like, try to keep doing it over and over. Because I know I have a lot of patients that will keep showing me, hey, look at my neck. You can hear that? You can hear that?
Yeah.
But yes, no, it's not going to do anything for you. And of course, if it's painful, I wouldn't do it. So don't continue to do it.
Yeah, I learned that later in life, because that was, like a warm up when I used to dance when I was younger. And so I would roll my neck and I would hear that. And I thought that meant I was doing a good thing. I was like helping crack things in my neck. And then I heard it was bone on bone. I was like, I was like, I don't know what I'm doing.
Yes, it depends. Like, there's all different kinds of cracks. That one usually is the one I would like try to avoid. That happens a lot, but like I said, if you're doing if you want, because the neck rolls aren't necessarily bad, aren't necessarily horrible for you if you have better posture doing it, because usually the more, like, should I say, slouched you are, or your head's carried forward more, the more you're going to hear that the bone grinding on each other, because it puts your spine at a more unstable position.
Okay, well, we'll definitely go into posture tips, but we'll first do the very basics of going to a chiropractor.
Yes.
So when are you supposed to go to one? Is it when you're feeling pain, or should you go for preventative reasons?
I would honestly tell you if you're feeling pain. And usually pains like your general, like if you're aching pains, neck aches, or low back pain, or if some kind of pain you're not even sure about, you can even see one, and they at least, the least we can do is diagnose and tell you, hey, we can help you with this, or hey, I recommend you going to your primary for this. But yes, any kind of aches and pains, I would tell you definitely worth going to see a chiropractor. Not really as necessary for preventative right now if you're not having any aches or pains.
Okay, if you feel like, oh, this side of my hip pops, this is actually a personal question, but if there's like this sometimes that your like hip makes a popping sound when you do a certain move that the other side doesn't do and probably isn't right, should I be going to a chiropractor or just ignoring it? Which I think, listening back to myself, I answered my own question, but what do you think?
I would tell you something like that too. I would tell you,
because it's not painful, but like, it's like, I'm sure there's other people that like, oh yeah, I had this, like my thumb always makes this like pop sound or whatever, but I just crack it and it's all good. So if it's nothing painful, but it's different, does it matter? Or
I tell you, if it really is something, because there's a fine line. Okay, if it's a pain or a discomfort too, it's always, I tell you, it's worth getting it checked out by a chiropractor too, or a physical therapist to figure out, why it is, because I know it may not necessarily be an injury or have it, but it's some kind of discomfort that it may not necessarily be, hindering you from life and living, but it can like be of an annoyance to you. So I tell you, it's worth it to even just get a consultation. I know some chiropractors that could at least go through a full examination where they'd be like, hey, this cracking, popping, snapping, whatever it is coming from these reasons, and at least they can give you some answers. And a lot of chiropractors are willing, and physical therapists are willing to do that initial consultation for you to spend as much time for you to find your answer. So it's always worth bringing if you're unsure about something too.
Yeah. There we go. I put you in an awkward spot giving me an actual consultation from a distance. So
No,
thank you for answering that pretty well. So you kind of lead me into my next question. What is it that a chiropractor is doing? What is it that you're skilled in that you do that we would go to you for?
Okay, so as chiropractors, we're all trained to be the experts in anatomy and how it works with your nervous system and your skeletal system, meaning how your muscles work with your joints and how those work with the nerves. So if you have, I'm trying to not get too fancy here, but we're specialists in anatomy and how, shall I say, our body works optimally and what things we need to do for our body to allow muscles to function properly, allow our body to move properly, and move, of course, pain-free. So that's where our bread and butter comes from, is regards to making sure we have our best optimal body for the types of activities, exercises, workouts we want to do.
Okay. And, we were talking about popping sounds and the different sounds that you're either causing or that you're hearing or that you're diagnosing. You see all those videos of chiropractors, I don't know, pushing some part of a patient's body and making a big crack or pop sound. Yes. What is it that you're doing? Because it looks like you're killing them. So what?
It really does. Ton of blaming. Honest assumption there. I hear from everyone. So what we're doing right now, if you've ever grown up, I'm doing right now, popping my knuckles. You have these capsules in your joints that, shall I say, are needed to hold joints together. However, they can get stiff too if you don't move them often. And when the chiropractor necessarily, what we call, either cracks them, adjusts them, pops them, you're actually freeing up any, shall I say, of that gas that's trapped in these, what we call, joint capsules. And when you release it, it releases that gas and makes that sound. But what we're honestly doing is opening up joints that have been locked up for who knows how long. It could be, but like in your knuckles, that's why you have that popping every time you, or every now and then when you move your hands and stuff, or your hip pops or your neck pops. That stuff all, is caused because that joint is finally kind of opened up. And that's what we're trained as chiropractors to do, that at a specific level where your body may need it the most.
Got it. Yeah, the cracking the knuckles. I mean, people love to do it. It freaks me out. But you're saying it's an okay thing? It's actually a good thing?
I'm going to tell you the simple words. You're getting rid of any the stiffness that's in those joints when you're doing that. Because it's just the sound it makes is due to the gas being released out of the capsule, which you can get all the fancy stuff about it. But honestly, you're opening up any joints that get, in basic terms, gets locked up. But cracking your knuckles, honestly, I know people mention that it can cause arthritis. However, that's not true. That's just something that's been passed down. I don't know, over the years. I heard it from my grandma, and then
so it's a myth, though.
Yeah, I would say it's a myth for the most part, because all you're doing is moving those joints. Now, if you're having pain in your joints from doing it, then that's where I say seek a provider and look at that, because you may have arthritis coincidentally, but the popping's not going to cause that itself.
Got it. What about when someone asks you to walk on their back? Obviously not a chiropractor. Do chiropractors do that? Or is that just something you do with your friends when somebody's like, oh, my back? Like, step on my back.
That's usually something with the friends, honestly. Or like I have like followers or patients that are moms and their kids will walk on their back too. That's not necessarily a bad thing when it's, it depends on of course, who's walking on your back, right? I don't walk on people's backs, but if it's their kids walking their back and because we have massage therapists that do it. If you've ever heard those Thai massages? Oh yeah. Yeah, they have certain massage therapists that hang, like they hold onto like a ceiling rail or something like that, and then they'll walk on the back. So for the most part, I would tell you in the long run, having a professional do that for you at those Thai massage places, if you really want the right muscles to be pressed on. But walking on your back is not a bad thing. They're just basically massaging you with their feet, you know?
Yeah. Okay, so we'll do some more kind of pain relief, self-care topics.
Okay.
What are some common causes? I know we kind of touched on like the phone one, but are there other common causes of having different kinds of pain?
Yeah, the biggest thing is I would tell you support what kind of chair you're using, what kind of support you have for your chairs, because most chairs in our car or work or airplane, whatever it may be, are not designed for our body to be, to maintain good posture, to be honest.
Oh, okay.
Those are big things. Now, do you want me to mention some advice?
If you have some advice to throw in, sure.
Yeah, I'll throw. Honestly, there's not really one number one chair for everyone. That'd be great, because we would all have it. But there's ways you can implement and make your chair better for you. If we want to help improve, let's just say posture and prevent some types of middle lower back pain. My biggest thing for chairs, always have a good support right behind the lower back, where some people will put a pillow behind their back. Some people will roll a towel in a cylinder format and place it behind their back. Or they have these little things you can get on Amazon. They're called Lumbar Rolls. I like to mention that because they're on Amazon. Everyone's got Amazon. At least I hope so. And they're not too expensive. But it's something to support your back, because your back, if you all notice, it has like an arch in it and things to help cushion that, kind of like give that support, will allow your back to not strain over time or get tighter over time. So that's my one thing to have. And I would tell you, for our desk workers, I would say having a computer that's monitors at eye level. Yes, that's perfect. Making sure your arms are relaxed on your desk. Those are a couple little tidbits. And then even that car support, that lumbar roll that I mentioned earlier, you could put that in, chair support, you can put that in your car as well. It's all about like trying to improve all the little bits of your daily life, because a lot of us do commute for work. A lot of us do sit down for work. A lot of us have been cooped up at home too, because of the COVID.
Yeah. You actually bring up a question I was going to ask. What's worse, sitting all day or being on your feet all day?
I would tell you sitting all day. Sitting all day
is worse. Okay.
Yes. If you're on your feet all day, my assumptions is you're moving around more. You're getting more, movement through your body, and that's better for your body to keep your muscles relaxed, have more blood flow. But here's the catch. If you're standing, in the position all throughout the day, that could also be detrimental for you too. But at least when I know if you're on your feet, you can move around more. So overall, I would pick on your feet all day as opposed to sitting all day.
Okay. Yeah, because in my career, so I work in casting, sometimes I'm sitting at a computer all day, doing research or, scheduling auditions. And then when I'm on set, I'm on my feet for like 14 hours at a time. And I'm like, I don't know which one's worse on my body, but I'm just ruining it in both ways, I guess.
So, honestly, with that's, you have a tough job where you have kind of like that, both of those battles. So my big thing then is if you're at the desk, just optimizing your desk setup, that's easier said than done. So just making sure everything you're on the computer for seems like all day, you have the best chair setup you can get, or best support. And then on regards to on your feet all day, having comfortable shoes that if you need certain support in the shoes, I'll get that.
Are there certain shoes or shoe inserts that you recommend?
Honestly speaking, not a particular insert. Now, I would just tell you very generally, at bare minimum, if you ever heard of Dr. Scholl's, like they said, like Target and Walmart, those gel inserts with the arch support, they're better than nothing, and that can give you just that extra cushion in the shoe you need. And that can, try that first, because there's a lot of great shoes out there. There's not a number one that I know that, does best for everyone, but trying the shoes is a little bit of like a cheaper option before you make the investment on brand new shoes. That's one way. And a new little tidbit I've, well, not really new, but something like my patients love more now is toe socks. Like those socks that
oh yeah.
They look like they're basically like gloves.
Like gloves for your feet.
Yeah, especially we got gloves for hands now for our feet. So that's actually a really awesome thing for a lot of people that have a lot of patients are on their feet all the day, and their feet just ache and burning, and in their arches. So that's helped them tremendously too. And it doesn't look goofy because it's in your shoe, you know?
Yeah. All right.
Yeah.
This is another personal one, but I just have to know the answer if this is true or not, because this is from a friend of mine. How do you know if one leg is longer than the other? And if they are, is that a problem? Is there something you should do about it? Is this a weird question? I'm not sure.
No, it's not a weird question at all. Like, it's a very common question I get. So, especially when with chiropractors, you know, we do specialize in looking at leg lengths. However, it's something. My big thing. There's different types of reasons for leg lengths. The more common issue I see as patients is there's a muscular imbalance in your body where one side of your muscles is tighter than the others. It's kind of like, you know, we grow up having side dominance. I'm right-handed. Are you right-handed?
I'm actually left-handed.
Okay. And then, so even that though, now that we have the, you know, our own dominant side, our body's going to have to, shall I say, compensate due to that. So sometimes even if we're right-handed, left-handed, the opposite side of your lower body may compensate, or vice versa, meaning that you may have tighter muscles on one side of the body versus the other in regards to your hips. And that can actually make it look like your legs are, one leg is longer than the other. That's one reason. Tight muscles. And then there are some odd cases. They're not very common where your body's actually genetically formed where your one bone's longer than the other. So if you're not sure, I would tell you it's worth go seeing your physician, because even primary physicians can do tests to see where that's coming from, or chiropractor too. So you can at least get those looked at. But you know, it depends on where you go, you know, where that cause is. But most people have muscular issues. And to keep it simple with that, very commonly that asymmetry is not an issue with your bodies as long as you're not having any pain in, let's say, for example, lower back pain, hip pain, knee pain, foot pain. Then I would tell you go seek a physician or chiropractor or physical therapist to get that properly evaluated and make sure, you know, it's not going to lead to any further injuries.
Okay. So I actually had a listener, her name is Krishna. I don't know if she specifically herself has back, neck, and point pain, but she did want tips. But she did say that she wanted tips about back, neck, point pain, needs some tips. That is what she said. So want to make sure that we cover all of them. So, and she's saying point pain. So that sounds more specific than just like, oh, I feel sore or something. So what might that unique experience be? What are maybe some other tips? I know you've named some already, but do you have any others?
Oh, yeah. So point pain does sound like we'll keep it it sounds like a sharper pain to me. So
I would imagine so. Yeah. And I've had that before, like in my lower back, like once in a while. I'm just like, I think something's wrong with my kidney, but then it goes away and I ignore it. I sound horrible. I need to go to a doctor.
Yes. You're just letting yourself out there. It's okay. But now we're figuring it out. Okay. Well, you have me to talk to right now. But what was I going to say? So back to point pain. So with point pain, keep it simple. If there's something like that, it could be something that's a little bit more irritated in your body or inflamed to me. And that's a very key, kind of correlations when you're having sharper pains and or what they call spasms, or if your back catches, like you said, you'll feel random sharp, like a stab every now and then, and you don't know where it's coming from. So that could be something that's a little bit more inflamed, where I would tell you to seek your local chiropractor, primary physician, physical therapist, because there may be a little bit more work to be done for the areas, or treatment to be done, or depending on what it is, proper exercises. On my end of things, yes, improving your posture probably is going to help some with those kinds of pains. However, it may not, fix it in the long run, where you may need some extra help on it. My things may help over time, but it may be a longer process. That's why I always tell you, all my tips are just some ways to kind of get some relief in between your normal appointments. However, with the point pain, a lot of times with inflammation, I usually don't directly recommend this, but icing does help with inflammation as well, and sometimes can help with point-like pains or sharp pains, just a general rule of thumb. But I would seek a physician to make sure of that for yourself.
Okay. And I had another one from another listener, Steve. Are there any like at-home remedies that really work? And I think you can kind of just tie this into any kind of final advice, maybe with posture or stretches or sleeping tips, any other kind of things that can help us either feel better or avoid pain?
Yes. So throughout the day, I think in the long run is figuring out how to optimize the positions you are in most of the day. Meaning, like, how do you make the best setup for your desk if you're working at a desk, or if you're driving around the day? How do you have the best support for your car? And kind of those things I talked about earlier, having the lumbar roll is one thing. Those are my big things. Is first figure out, okay, what parts of your life are like, all right, where in your day is the most comfortable for your body? So, like I said, there, and figuring out, okay, if that's the case, how can we improve those? And I, unfortunately, with the audio, I can't really demonstrate it for you. But if you go, I have a bunch of those on my page, some of those self-help tips. But making sure you improve all those areas that are uncomfortable with or comfortable for you, having the right support, pillows, for example. For sleeping, I did a video where you can kind of modify your pillows for if you're having pain with sleeping. And once you get those down, great. And then the next little piece of advice is, if you're stationary a lot throughout the day, is setting time. Even if you have to set an alarm to get up and move, if it's every hour, that would be optimal. I have patients sometimes either get up and move every hour, like if they're at an office and they go use the restroom, whatnot. And on top of that, having a good set of stretches, maybe something from my page or from somewhere else, but making a routine of regular stretching for your body. The more you do that, the more you can maintain being pain-free for a longer period of time. But those are my big things to touch on. Honestly speaking, it's hard to implement new stretches into your routine, but if you can get like I said, all this chair support, chair support, sleep support, all that stuff down pat, that's already going to help tremendously, because it takes a lot of that stress out of your way, and then you can add the stretches in once you fit the time in, because learning new things isn't easy. I've learned myself trying to force patients to do exercises. It's homework. We don't want to, lots of us don't really want to do homework, but if you can inch yourself into it, you'll get to the point where you can handle it better. That's why I say optimizing all those other aspects of your life, because you don't really have to think of it as a chore. If you improve your chair already, it kind of takes away of the idea of, I got to do some stretches,
Yeah, definitely. And I will say it's a great segue to talking about your social media, because, your videos, not only are they very easy to follow, but a lot of them go along with some popular songs. So it's just a fun time all around. That being said, first of all, thank you. I'm glad our schedules aligned for us to have you.
Man, you're very, very humorous today.
Oh, there we go. So for those who want to see those videos and get some of those stretch tips, where can people learn from you, or maybe even get adjustments from you?
Yes, so you can reach out to me. Of course, my socials, Instagram is at dr.remix_. I couldn't get the original name yet, but on TikTok I am at dr.remix or dr.remix for that one. So those are my two big ones. If you're interested in scheduling an appointment or reaching out to me, there is a link in my bio to do either of those.
All right, perfect. Well, thank you for adjusting our knowledge on pain relief.
You cracked me up.
I got one last one. To everyone listening, just like my guest, I got your back. We'll have another episode.
She's stealing my job.
I'm sorry. There's so many. We're good for this one. So we'll have another episode for you soon. Thanks, everybody, for listening.
Thank you all.
I hope this episode helped. Please subscribe, rate, and review to support the podcast. And follow along for more hacks, tips, and failed attempts on Instagram at How Did I Get This Far Pod. Well, that's as far as we will get for now. I'm Amanda Ogun. Thanks for listening.